Welcome to Policy Connecting Communities. I'm Anna Goulet, your host. Our podcast exists to create a space for state and local community members to come together and give voice to the real-time lived experiences of public health issues and solutions across cultural communities in Minnesota. It's produced by AG Consulting and Media, a health communications research and stakeholder engagement agency with a cultural and linguistic lens. Our mission is grounded in building authentic community engagement and partnerships and amplifying communication and health messages that resonate with hard-to-reach communities who often face disparities and difficulties in accessing essential services. In today's episode, we will explore health disparities, leadership, justice, and the role of legislative advocacy. With us today is Ruth Richardson. She's the first Black person to serve as the president and CEO of Planned Parenthood North Central States in its over 100 years history. She's a lawyer, health equity champion, and a trailblazer. Ruth made history in 2018, becoming the first Black person elected to represent her district in the Minnesota House and was re-elected in 2020 and 2022. Passing more than 50 bills that were signed into a law between 2019 and 2023. As maternal health leader, Ruth is uniquely positioned as a longtime advocate for equitable health care access to lead the fight to ensure all patients can access care, no matter their race, income, sexual orientation, gender identity, or background. I'm excited to have you here, Ruth. Welcome.
Thank you for having me.
Before we dive deep into heavier topics, I would love to know a bit about your journey. How did you get started in this field?
Oh, it's such a good question. And when I think about sort of my walk with purpose to the work that I'm doing today, it really started in my childhood. At the time, I didn't know words like health equity or the social determinants of health. Or reproductive justice, like those were not sort of words that were within my vocabulary. But as a young girl in elementary school, I remember hearing my mom's birth stories. I have 7 brothers and sisters, and um, my mom had the experience of birthing with her with my great grandmother, her grandmother, who was a midwife, and she also had the experience of birthing in a segregated Mississippi hospital. And I remember hearing those two very distinct sort of birthing stories and hearing about sort of what she experienced in that segregated hospital and the mistreatment that she experienced. I was sort of in the moment taken aback. And when she explained to me the way that she had been treated was not unique to her, that her sisters had experienced similar treatment, and other Black women in the South had very similar experiences. For me, it was like that recognition that it didn't have to be that way. And so I think very early on, it was the power of those stories that I heard growing up that really put me on the path to the work that I'm doing today.
Thank you for sharing that. That's powerful. Um, and I think you've sort of talked about my second question, which was if there was a defining moment that led you to focus on health disparity or women's health. I think the example that you share demonstrates that, unless you want to elaborate more.
Yeah, I think that it's just sort of that reminder about the work that we do every day, because we hear a lot of different data points, and the data is really important, but also that reflection on how important and powerful our stories are. to um, not only sort of the paths that we choose to take in terms of where we focus our energies and our talents, but also the importance that those stories can hold in terms of really being able to change things for the better in communities and giving us the insight to try to leave the world a little bit better than what we found.
When it comes to health disparities, we often hear health disparities. I know the word you said earlier, there's different vocabulary that has been used to capture health inequity or health disparities. What do you think are the biggest misconceptions people have when it comes to that word of disparities?
I think one of the biggest misconceptions that people have is, when we talk about some of the unacceptable disparities and inequities that we are seeing, and you can sort of pick a topic. It could be around the preventable maternal health care mortality crisis, or the infant mortality crisis, or just thinking about across different areas of health of where we are seeing inequities and disparities. I think oftentimes people will sort of boil it down to individual choice, um, or like this framework that might go to um, blaming an individual, or thinking about it in terms of blaming a group of people for the outcomes that they are seeing. And I think it's really important to sort of recognize that in the ways that our systems have been designed, the outcomes that we see at the other end of it, they're not surprises. They're predictable outcomes that are a reflection of the way that that system was designed to work. So if you even go back to like the origins of obstetrics and OBGYN care, um, that field grew out of some very brutal research experiments that were done on the bodies of enslaved Black women. And, when you fast forward to today and you see the data that, nationally, Black women are 3 to 4 times more likely to die from a pregnancy related cause, and then you dig down a little bit deeper and you see the data from the CDC around maternal mortality that shows that more than 84% of those deaths are preventable. It really begs the question around, as we think about the outcomes that we are seeing, if they're unacceptable, what are sort of the roles that each of us play, and in terms of really being able to change the trajectory and really change those outcomes. Because when you look at the research and the data, Black women are not going to be able to earn their way out of or educate their way out of the maternal mortality crisis that we are seeing within this nation. And so I think it's a real opportunity for those who are truly invested in terms of elements of ensuring everyone has an equal opportunity to reach their optimal health, to really be thinking about their role uh, in addressing these preventable crises.
And I think that's the misconception. It's we often don't think about maternal health being more over dangerous to the mom or to the child because of how advanced the healthcare system is in America. Whereas when I went back home, I met and I spoke to a lot of women who have had miscarriages or died on childbirth. But then I also hear a lot of like the experiences of African American women being different, right? The outcome being different. And now the second generation in my community is here and their outcome is different. And it's how much is the root causes that contribute to disparities can be attributed to a lack of systemic care or prenatal care or just biases or misunderstanding that is not that's not changing the outcome for women's health, and it's creating that disparity for Black women versus maybe other races.
Yeah, you're asking, I think, the really important the really important questions that really kind of get to the root of the issue. And when when you look at, for example, and I'm so glad that you lifted this up around how immigrants, African women who come to this nation, how that first generation has better maternal health outcomes than Black Americans who have been living within the country for generations. And then you wait, and now you see kind of the second generation is moving in the wrong direction in terms of their maternal health outcomes. I think it's important to really lift up when you look at the actual research, and Dr. Rachel Hardiman at the University of Minnesota and so many other national researchers like Dr. Karen Scott, uh, there's a whole wealth of research data out there that shows that you can control for all the factors. You can control for general overall health and nutrition. You can control for housing, access to insurance, uh, mental health, substance use disorder status, socioeconomic status, education status. Black women are still more likely to die from a pregnancy related cause, even when you control for all those factors. And in fact, a Black woman with a PhD and a college degree has is more likely to die from a pregnancy related cause than a white woman who didn't finish high school. So when I'm making that statement about this isn't a crisis that we can earn our way out of or educate our way out of, it's a real true recognition about the role that systemic racism can play in terms of impacting the health outcomes of communities. And when you think about this in terms of thinking about the stories of like Beyonce Knowles or Serena Williams, I think Serena Williams' story is one that made national attention. And Serena experienced what's called a severe morbidity event, which is a near miss, meaning she almost died during pregnancy. And in her situation, after having a C-section, she was having a difficult time breathing. She's a person that had experienced blood clots before, and she recognized that with her labored breathing, hey, something's wrong. I may have, a blood clot. And so went to the nurse and I want you to think about this after going through a C-section and the process of what it would take to get up shortly after that C-section to go try to find a nurse to ask for care. And sort of the reception that was received from the nurse was like, oh, you just had a C-section, you're probably like a little confused. And she was recognizing that she was having this difficulty breathing, and asked for a CT scan because she wanted to see if there was a blood clot, right? The It took hours for her to be able to get that CT scan. There were some other tests that were run, but by the time that they finally ran that CT scan and discovered that, in fact, she had a blood clot that had traveled to her lungs, she had experienced such violent coughing that it ripped open her C-section. And as a result of that, she had a much longer recovery road ahead of her, and was in a place where she couldn't even like bond with her child in the way that you traditionally bond with your child because of the delay and the care that she received. And luckily, she survived. But I think Serena's story really illustrates kind of the point that I'm making here, because you can have access to the best doctors, you can have like that socioeconomic status, you can have that name status, like people can know who you are. And in that moment of where she needed help and she asked for that help, she was denied. And so imagine being in that position where you don't have the wealth, the name recognition, or the fame, and that is what is happening across our nation when we see and hear so many stories of families who are begging for help and don't get it, and the results can be different. And for me personally, having a cousin who died after giving birth, and knowing that 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 space of someone being in such a vulnerable position, because giving birth is such a vulnerable space to be in, and even that postnatal period after giving birth is so vulnerable. And imagine begging for help and having those cries going unheard. That's what's happening across our nation.
Thank you for sharing that. What are some of the biggest challenges when advocating for policies that support Black women, particularly around mental health or justice or community empowerment?
Another really great question, and I think one of the biggest challenges um, is oftentimes when we are going to a community to have conversations around what the needs of community are. As a legislator, and I kind of going back to kind of my previous life within the Minnesota House, um, it was really important to me whenever there were bills that I was working on that was related to inequities and disparities in terms of health, whether that was like access to care in some way, or maybe we were seeing unacceptable like outcomes. I think it's really important that we're centering the voice of community, and that we're centering the voices of the community of the most impacted, because it's important to understand what they are experiencing. And it's also important to understand what is going to be helpful. And I think so often the way that uh, policy and legislation has worked, it's sort of something that you're doing to community as opposed to doing it with community. Um, and I think that sort of shift uh, that we see when we sort of are truly um, uh, centering community voice and centering community experience and really seeking to understand what communities are experiencing, it gives us insight, and it also gives us notes of inspiration when they are telling us this is what we as a community as a community needs. And not all legislation is approached in that way. And it's also a way of leading that is messy, right? Because it's what's the old saying that you can go far, just if you're going alone, you can move fast, but if you want to go far, like how you can like work together with others in collaboration to really kind of get to the point that you want to get to. And so when you're working within community like that, it can feel hard, it can feel messy, and you can also kind of have those tensions of where people are not necessarily always agreeing on kind of the scope of things. But I think in the discomfort of that tension is oftentimes where we're doing our best work, because none of us are as smart as all of us. And so as we have those conversations and that back and forth and really get the opportunity to hear from people with a lot of different and various perspectives, that's where I think in the messiness of it all that we do our best work.
Absolutely. I often think of health disparity that in two folds. I look at it as if we actually provide equitable services to all our stakeholders with the resources we have, and we're still going to need some culturally appropriate, maybe even linguistically appropriate services to reach hard to reach populations, right? Where one size is not going to fit all. So even in the best case scenario, we have to be able to show what are the additional steps that we're taking to make sure that the method that we're using to communicate, the method that we're using to deliver services is not in, inadvertently leaving people behind, and that we are taking additional steps so hospitals have some advocates. There's even been some research that showed that even for native English speakers, like the African American mothers and fathers, when there is a health advocate working at the hospital, their health outcome is improved. When you have a non-English speaker, when you have a translators and interpreters, their health outcome improves. When you have maybe just forms that are culturally norm, services that are culturally norm, then that also increases and elevates the outcome, whether it's healthcare or just going to get a pay a bill at the justice, at the court or whatever the case might be. So you need to, more often I feel like providers need to evaluate what they're doing. How are they designing the services that they're delivering? And how are they measuring their accountability to all their stakeholders? Because I think a lot of times service providers are not accountable. They're not held accountable to the services that they provide and the people they leave behind, which then perpetuates more disparity for communities of color. And there isn't enough resources exclusively dedicated to then reach those communities separately, where you have nonprofits and things like that that can then go out there and do some of those grassroots work, whether it's about addressing homelessness and things like that. And from my experience, even as large entities are drafting policies, those community specific resources are not always centered. And also the fact that the way that they deliver services is not always showing how they're doing to address that. But there's always this talk about, the data and the disparity. When you were a legislator, was it frustrating for you just to keep hearing the data, knowing that we are all accountable to address the solution in the mechanisms that already exist, or the resources that you're providing and you're approving as a legislator are not really resulting in the outcome that is possible if the community is part of that solution, if the community is forming that solution, if the community is delivering that solution?
Yeah, I mean, there is such a rich statement there. And I want to start with the measurements, right? Um, because you can't improve on things that you are not willing to measure, because how do you know you're doing better if you are not doing measurements? And so the data piece is incredibly important, right, in terms of measuring. But we also have to go a step further to really understand, what are we measuring and who gets to decide, right, what we are measuring. Because it's one thing, and I'll take the maternal mortality like review, for example. It's one thing to look at the number of people who died as a result of pregnancy related cause. It's another thing to dig and to really understand the why behind it, right? Because to that point, it's about really trying to understand, how do we prevent this from happening within the future. And one of the things that with maternal mortality review committees, and one of the spaces where I often found myself really frustrated, we we measure mortality events. For every mortality event, there is 100 morbidity events or a near miss where someone almost dies from a pregnancy related cause. And in Minnesota, we're not measuring those morbidity events in a way that we are actually like digging down the way that we do within the maternal mortality review committees, where they look at the information and they identify kind of root causes. And also within that analysis, they can find when deaths are preventable, right? And so, with that gap of like not having a morbidity review, and the fact that those happen so much more often within our state, and so much more often within our nation, when we're not studying that, we lose out on rich information, because those morbidity events and near misses, some of those are severe morbidity events that will change the outlook for someone's life for the rest of their life, right? And so that data piece, to your point, and that measurement is so important. And what's also very important is that we move beyond just admiring the data, because I feel like we do a lot of admiring data. It's like we have all of this data that we are constantly sort of putting out and talking about around disparities. But where is the work of the actual action to change the direction of that? And I also think that we are in a that we're in a space that when we are presenting the data, we should never be presenting the data without the stories. Because when you actually have the ability to see this data, and then you actually have the ability to hear and see from someone who has been impacted by this, I think that that is a very powerful combination that can be important to not only driving policy change, because the policy change is important, but we also have to go a step beyond getting the great bill into place, because we all want to celebrate when that great bill gets signed. But at the end of the day, after that bill is signed, there's also the day-to-day practice. So because we now have this bill, what's happening in the day-to-day sort of implementation of this? How are we holding people responsible for what we say that we want to do from a policy perspective? Is the bill actually resulting in the outcomes that we want to see? And I think that that is sort of the call for all of us, the call to action. We really need to think about how we are designing our processes, how are we designing our systems, and we need to design them for the outcomes that we want to see, right? And so I think that is where oftentimes a lot of the frustration can sort of come in when you see these really unacceptable numbers from an outcomes perspective. But at the end of the day, what are we doing to move the needle in order to do something different? And even with passing the policy, we can't just all applaud and go home because we got a great policy now. The next step is, how is it implemented? And then how are we measuring to actually make sure that it worked? And if it doesn't work, going back and fixing it.
No, I agree with that. And how often, when you were a legislature, did you have testimonies from leaders from different healthcare entities to come and provide the impact that they're making in addressing health disparities, and that they are the resources that they have is creating those changes?
Yeah, well, and to your point, that is something that you can actually put into legislation. Requirements that there are reports that would come back right to the legislature. I think about one of the bills that was passed around, it was a mental health focused bill, the Emmett Lewis Till Victims Recovery Act, for example. So there was an investment of dollars that went into creating culturally intelligent mental health services for communities that have experienced trauma. And as a result of that work, at the end of that grant period, there's actually going to be a report, right, that comes back to the legislature to be able to demonstrate like the impact of that investment. And that, I think, is really important work that helps to not only justify the resources, um, but based on the data, it can be used to help to understand, is this a space of where this is working really well and we want to invest more because we're seeing great outcomes on the other side of it? How many people were on the waiting list that were not able to get access to services? I think the more that we are setting up like these systems that are focused on ensuring that we are working with community, and again, that's another example of a bill that was built out of unspeakable community pain. But this was the community coming forward and saying, what we really need in this space are some mental health services, some healing services for community members who are experiencing some of the worst loss, right? And then being able to come back to the legislature to make the case for the continuation of the funding, um, and potentially the growth in that funding as well. So I think that that is always something that is available, and I think more bills should use that structure to really be able to show that we are getting to the outcomes that we want to see.
I agree with that. Without accountability, it's hard to know the impact that the funds are making, whether it's from the legislature or from larger foundations or private sector. Especially when it's about community, we need to really pay attention closely because this is a human problem and we can address it, right? It's not impossible if we at least put the right mechanisms in place to move the needle, at least in some of the big health disparities that our community, cultural communities, or community of color are experiencing. You talked a lot about maternal health, and it's a topic, especially with African American women and girls. That's a topic that seems to be existing problem, data wise, persistent problem, and something that is probably becoming again, it's becoming a similar outcome for the second generation, even immigrant Black communities. What are some of the other disparities that you have, that you feel like we have huge disparities, but we could perhaps, I know mental health is another one, obviously, addiction is another one. When it comes to health disparities, can you talk about any key policies or legislative efforts that you have been involved in that have led to a meaningful change when it comes to health disparities in communities of color, or even in particular Black girls and Black women?
Yeah, it's a really, really good question. I mean, one of the things that, as you were talking about that, that came top of mind was a bill that I worked on with Senator Bobby Joe Champion that ended race and ethnicity discrimination in organ transplants. And one of the things that really got us to a place of being able to get that bill passed, and I remember going through the process of the health and the Health and Human Services Committee, and having bipartisan support in terms of moving that bill forward for consideration, was to educate members on the Black coefficient that many of them were completely unaware of. So the Black coefficient um, is a race-based form of medicine that has no basis in science. In fact, it's based on false science that Black people have more muscle mass than white people, which is not true, and which has been debunked for decades now. But under the Black coefficient, when a Black individual would be evaluated for their kidney functioning, the Black coefficient would actually add numbers to someone's kidney functioning score if they were Black, based upon the Black coefficient. And that would mean that it would make their kidneys look like they were functioning better than they actually were, because they were adding the Black coefficient to it. They're adding numbers to make the kidney functioning look better than it was actually looking. And as a result of that, it was delaying people being added to the kidney transplant list, um, anywhere from 2 to 4 to 6 years. And as a result of that, you would see more Black people dying on the kidney transplant waiting list because they had been held off of it for so long because of these additional numbers being added to their kidney functioning score. And so to have that, what was happening to people is you saw Black people being lower priority on kidney lists because they were being held back from being added. And so that bill is one that we saw just some immediate results from. And Dr. Bernadette Johnson, who is the former um, uh, Minneapolis public schools administrator, um, just recently told her story about having her priority uh, on a transplant list being upgraded because they took out that Black coefficient score and actually put her in line to get a kidney transplant in the time that she really should have been getting it, as opposed to this arbitrary number. So I think that to me is one example of how you can have something that is happening, that is having this outsized effect on a population, but for most of the people who were a part of that hearing, it was the first time that they had ever heard about the Black coefficient. Like, so this is something that's like happening under all of our noses, but it takes uh, issues being lifted up, which I think is also, it also speaks to the importance of how much representation can matter, because the people who are sitting at the table are deciding what's on that menu, right? They're deciding what bills we're hearing. And if you don't have sort of that diversity of thought, that diversity of experience, you can have these really harmful practices continuing to happen like right under your nose.
No, you speak a really good point and a good example that shows how policy can make a difference in terms of, addressing health disparities. But then when those policies are drafted, they go through review process and they basically get shuffled and pushed around, and before it becomes a law, so much of it is left to the drawing board or never even get a chance to be heard or champion or author as a legislature. So I think just what what would be your advice, having had that experience that you had as a legislature, knowing that by the time things come to your desk, knowing there's still plenty of them that's never made it to where you're sitting or never made it to become a law, that would make a huge difference in terms of health disparity. What advice or do you have for listeners in terms of the role that advocates and activists in community can play in shaping public policy and laws?
Yeah, I would start with the first sort of rule, relationships. So much of this is about building relationships, and because those relationships can be key to helping to influence what agendas look like. Um, the second thing that I would also really uh, encourage people to do is to take up space in the Capitol, because always remind people that the Capitol is the people's house, right? That's not owned by a certain segment of the population. That's like owned by all of us, and so making sure that you're showing up and also like speaking out about the issues that are most important, that are the most important to you. Um, Joining coalitions, it can be really hard to navigate the Capitol if you're not used to being in that space. And so, a nice sort of warm entrance into how the Capitol works is to find other like minded people who are fighting for things that you are interested in fighting for, because that gives you an opportunity to participate in a day at the Capitol. There are so many different days at the Capitol that happen every legislative session. You can tell me about an issue that's important to you. There's probably a day at the Capitol that is focused on that work. So if you're interested in Black maternal health issues, like find the people who are doing that work. Healthy Black pregnancies, for example. Um, uh, the Birthing Justice Collaborative, like being able to find those like-minded people that can help you to learn and fight for the things that you think are really important to moving forward. And I think the last piece of advice that I would give people is to uh, find people in that space that you can learn from in terms of how the system works. It can feel very daunting and overwhelming of like, how do you testify at a committee hearing? How do I know where to go? And what I think is, and I think oftentimes that can keep people out of spaces because they're worried about coming to a space that's unfamiliar or where they feel uncomfortable. But if you are not there um, fighting for the things that are important to you, you're likely going to be on the menu, is what I tell people. It's like if you're not at the table, the things that are important to you are likely going to be on the menu.
I agree with that. I think it is an intimidating space though, because most of us in our communities, if they're doing nursing work or if they're doing social work or, a lot of times they're doing the good work, they're doing the good work. But I always look at policy as that umbrella that you need to push the boundaries, to make those differences. So how do we become the people who are doing what they're doing, whether they're social workers or nurses or barber work, her salons, her stylists?
Yes.
How do we ingrain in us that the changing or supporting legislatures or championing causes, there's a roadmap? And do we always know the organizations that support those roadmaps? For example, NAMI, they do a lot of educating of NAMI members about how to give testimonies. When it's a mental health day, people show up, they share their stories, they talk to their legislatures and say, hey, please vote for this bill. Um, Mobilizing community members, right, who are probably stretched and stress and parents and you dealing with their day to day. Do they always know who is their legislature or how to support an important issue, or who is the organization that can provide that training and education?
Yeah, that's a really good question. And so, what I would encourage people to do is, if you're really interested in mental health, right? NAMI is a great place for people to get connected with. And not everything that you can do needs to happen in person or needs to happen during the workday. Say if you can't make it to testify, you can submit a letter. right? And your letter can become part of that committee record to show your support for an issue. Lots of organizations will have kind of email signups. So if you're interested in like nursing issues, like there's a nursing day at the Capitol. There's a Black Nurses Association, for example. Those are sort of places that you can sign up to get their email notifications. And sometimes they'll have these call to actions, right? That will say, okay, everyone email such and such senator and say, vote yes on this issue. That's really important to nurses. If you are a teacher, and you're an educator, there are different organizations that you can get connected with uh, that can help you to sort of understand what are some of the policy issues that you can be fighting for. And then I think it's also important for people to understand that you may just be in a space of where you yourself are experiencing something that you don't necessarily see a lot of people fighting for. You don't sort of see those natural allies. That's where you reach out to your elected officials, right? Where you can have those one-on-one conversations to raise issues or concerns that can help to shape perspective. And that might be something that leads to a bill, or it might be something that a legislator can reach out to someone with and help someone like solve an issue. Because I think it's also important to recognize not every instance needs a bill. Sometimes you just need sort of an advocate on your side who can help to bring a perspective to someone else and help them to get some help or assistance with something that they need. And I think, and I recognize exactly what you're saying, because families are oftentimes dealing with so much stuff all at one time. It can be really difficult to get away or to have the childcare that you need. But I've also seen people come with their kids to testify on bills. When I had the Dignity in Pregnancy and Childbirth Act bill, one of our most important testifiers came with their 2-year-old daughter who was in that space, and I think really also brought a face to like what we were fighting for, within that moment.
Yeah, that's a really good example. It's a good example to share to empower our communities to take part and see some path forward. We touched on a lot of things with regards to policy and health disparities, and I wanted to wrap up the conversation and talk about some takeaways for anyone interested in creating change, especially in the area of health and policy. I would like to hear your takeaway in terms of anyone who might be interested in being in those spaces of becoming a policy position or working for a healthcare organization or leadership services. And I'm also interested, I didn't ask you this question, how much of like having these diverse experiences help shape you to become an effective leader in terms of this space of health policy and health disparity? Because you have a background in law, sociology, as a legislature, then working in nonprofit spaces. How much does having those experiences help you shape the type of leader you are? And what would you say to anyone interested in entering these spaces that you've been in and to learn or to make a difference?
I think what I would say to people is there is no specific sort of credential that establishes that you're going to be a good legislator, right? Because I think a lot of times people will ask questions of themselves and kind of struggle with what they think of like as imposter syndrome, to say it's like, am I ready to be in this place? Am I ready to lead in this way at the state capitol? I think what helped me the most is my life experience. It wasn't about having a law degree. It wasn't about, uh, you know, having achieved a certain degree. And in fact, I think that what is what is so important is that ability to not only bring kind of a unique perspective to things, because each of us have that, right? All of us have a unique perspective. That's not, no one has a monopoly on having unique perspective. We all have it. I think the ability to be able to meaningfully listen, not just listening to respond, but to actually to be able to hear people, is an important skill that you need as a legislator, and the ability to work with people, including people that you don't necessarily agree with. When I came into the legislature in 2019, after being elected in 2018, we were the only legislature in the nation that was split. The Senate was Republican controlled, the House was Democratic controlled. And so, with that structure, we all knew coming into that space, the only way that you were going to get things done is if you had the ability to work with people on the other side of the aisle. Because um, anyone who knows anything about civics, the House can pass a bill, that's great. But unless the Senate passes the exact same bill, it's not being sent to the governor for signature, right? For consideration. And so, being able to work across difference, I think, is also a really important skill to have. And for anyone who's sitting there wondering, do I have enough experience? Would I be good at being in the legislature? My response to you would be yes. If you're willing to do the work of the people, and you are willing to listen, and you're willing to work to build like a stronger state for all of us. Um, don't let people intimidate you from that work, because you get in these spaces and you just realize at the end of the day, we're all people trying to do work and trying to make Minnesota a better place for all. And if that's your goal, then you belong in the legislature.
I agree. I have one more question. Okay. Looking the path forward, you have good experience in some of the issues that came in front of you when you were legislature, some of the issues that you deal with in your current position, in your previous work, and just understanding about health disparity in general. Looking ahead, what are the key areas in both health and policy that need most attention? And what do you think needs to be prioritized in fight for health equity in the coming years?
Okay, that is a really big question. Because there are so many things, and the sad reality is, show me a system and I'll show you a disparity. So as we think about like what it means to prioritize, I think the response would be different for each person that you talk to. For me, and in thinking about the work that I've done historically, and sort of where my experience lies in, I think that there is significant opportunities to address both the maternal health crisis in the state and within this country as well, just recognizing that the entire crisis is wholly preventable. The same thing around infant maternal health. I'm also, one of the things that keeps me up at night is increases in domestic violence, intimate partner violence, human trafficking, and also seeing the disparities there. Because, like, we know in Minnesota that Black women are less than 7% of the population, but we make up more than 40% of the reported domestic violence calls. And thinking about the work that has been underway around missing and murdered Black women and girls and Indigenous relatives, those are all things that I think are near and dear. And then also thinking about access to healthcare, because so much of the outcomes that we see are around that access to care, and thinking about access to a full range of sexual and reproductive health care. And understanding, like, when you're cutting off access to abortion care, for example, that doesn't just impact people's ability to get access to abortion health care. It also cuts off their ability to cancer screenings, STI testing and treatment, access to birth control. And then also recognizing that increases in the maternal mortality, we're seeing states with the most restrictive abortion bans that have the highest rates of maternal mortality and the highest rates of infant mortality. And we're in this place of where we're going the wrong direction of those numbers that are increasing. And so, really understanding the interconnection of this work, it's hard to say that it's focusing on one thing. It's more of that recognition that we need to really be taking that reproductive justice lens, and this whole idea of an individual being able to decide if and when they are going to get pregnant, whether to have a child, not to have a child, and if you have a child, to raise them in a safe and sustainable community.
Yeah, you said a good point, which is this idea that we can address health disparity in the context of addressing social determinants of health. Because starting from, health and some of these other areas, environment where people live, whether they experience violence, whether they're experiencing housing crisis and job unemployment, and seeing that investment in those areas, in having a job with a good health care, with a good dental care, is going to bring that family closer to having a better health outcome, simply because they can now call different insurances and they'll say, hey, I'll accept your health care because you have a private care, or we'll pay for this procedure, we won't pay for this procedure. So I think if you have an area that you think we can get the best investment, the best outcome in the totality of addressing health equity through the lenses of health, social determinants of health, um, where do you see we can see those intersectionality and address where do we need to address to make the least amount of investment but the most impact?
So you're asking like the really hard questions on a Friday. Okay, so let me say this. Housing is the foundation of everything. It's difficult to do anything if you do not have safe and sustainable housing. Um, and so I would definitely lift up that importance of uh, the importance of housing, um, but also just understanding the interconnection of it all. For me, it's why I oftentimes go back with that intersectional analysis to this whole idea um, of reproductive of reproductive justice, because it really encompasses that reality of like, how do you sort of build a space of safe and sustainable communities, and like housing is key to that, but also your physical health and your mental health, like all of those things, just in terms of like thinking about kind of the hierarchies of needs that people had, they're all important. So, um, when you ask that question of like, where do you boil it down to that one thing? It's why I'm struggling so much to like answer that question, because it all matters, because it all has an impact on you, and your health, because your health is going to be built where you like live, learn, work, and play. Like all of those things are going to have uh, they're all going to have impacts.
So for you, as a mom, as a women leader, as a Black woman who's born with some trauma from just structural racism that Black people experience in this country, yet in a great leadership position at the moment, right? How do you take care of your health? How do you recognize health disparity and mental health and wellness and the loneliness that comes being on top of the food chain as a CEO in spaces that are not very diverse often, and even working for an organization that has some volatility, right? What are some things that you do to take care of yourself, to take care of your well-being, to take care of to make sure that you're not, you're paying attention to your own health and your own voice?
Yeah, it's an important question, because this work can be all consuming, because it's the kind of work that's never done. And there can also be and we can have these uh, moments of highs and joy, but we can also have like these deep valleys as well, where there can be a lot of really hard things and struggles that are going on. So I encourage people to be in that moment and to celebrate the wins, no matter how small they are, because it's important to center that and do that. I also think that, for me, um, family is very important, and ensuring that you are carving out that important time for your family and for friendships. And as a CEO, it can be very lonely, right? Because you don't always have the space or the um, ability to reflect on all of it with folks in a really full way. And so that's why I think it's also important for individuals to have kind of those key people in their life that can be accountability partners. So I've got an accountability partner. It's like making sure that we get our own appointments scheduled, right? Did you get your mammogram scheduled, right? Did you do this? And keeping you on task with those things, because um, it's easy to put yourself last sometimes, right? And
Absolutely, absolutely.
doing so much for everyone else and for community in a way that puts your needs last. And so I'm a work in progress. So I don't want anyone to hear this and think that I somehow have found that magic sort of wand, because it definitely is a work in progress. But I also think that it's important that people are also centering those elements of breastfeeding resistance as well, because as hard as we all work, we are also worthy of rest.
Absolutely. Thank you so much for joining us today, Ruth. Your insight and your incredible experience are inspiring and educational, and I'm sure our listeners have learned a lot from the stories that you've shared with us.
Thank you.
For anyone interested in learning more about the work that Ruth is doing and the legislations that she has worked on, we are going to link her bio into our website, AG Consulting and Media /podcast. If you enjoyed this episode, don't forget to subscribe, share, and leave review. We will see you next time on Policy Connecting Communities.
Policy Connecting Communities is produced by AG Consulting and Media. The Policy Connecting Communities podcast, produced by AG Consulting and Media, highlights the public health efforts and strategies used to empower and grow community and policy development.